Hi, Dr. Sarah with Functional Wellness Center. So a question that we get asked in our office from our patients is it okay to crack your neck? And so I wanted to go over this because it's an important question. A lot of us at times have tried to do this when we're in pain, and so we kind of go like this, and, or this, and you kind of, try to bring your head over, and maybe you hear a pop, and then you feel some relief for a little bit, and then typically the pain will come back. So let's talk about what you're doing when you're doing that. So when you are doing that, you have segments in your spine that are subluxated. That's what we call a segment that isn't moving properly. And so that segment isn't moving properly, it shifts out of place, locks up, and then it's not moving, and it can put pressure on the nerves, and it can cause a signal to go out as pain. Now, the other segments around that segment are trying to compensate. They're trying to move a little bit better because this one segment isn't moving. Now, when you go like this and you try to actually crack your neck yourself, what you're doing is you're moving the segments that are already moving. You're not moving the actual subluxated segment. And what can happen is the more you do this, you're going to create damage in the tissue around the spine. So you're going to create damage on the ligaments. So ligaments is the tissue that connects bone to bone. You can also create damage in the disc, which can eventually create a disc herniation in the neck. And then also you can create damage within the muscles and the tendons that connect to the spine. So in short, no, you don't want to crack your neck. It is very harmful to the spine, and it will create damage, long-term damage down the line. It can create a disc herniation. It can create degeneration, arthritis in the spine. And so overall, it is not a good thing to do. Now, us as chiropractors, you should really leave that up to the professionals, right? So when we adjust your spine, we actually take that segment and we direct it into the position that it should be in, and we make an adjustment in that area so we get that locked segment moving again. And it's very specific. And there's a lot of training that goes into learning how to actually do this in the spine. Now, you may hear like a sound when you do this, and you may hear a sound when we actually adjust your neck and get movement in there. And that sound, what that sound is it's gas bubbles being released from the joint when you get movement in a segment, when you get movement in the joint. The difference is that we're getting movement in the segment that needs movement, where when somebody cracks their neck, they're actually getting movement in segments that don't need that movement and creating damage. So I hope this helps. I hope that if you do tend to want to crack your neck, that maybe you think twice about it now. And if there is a problem going on and you are feeling pain or discomfort in your neck, definitely seek out a chiropractor to help you with that. Thanks. Bye.